I'd like to welcome everyone this morning, and my pleasure to introduce Dr. Shawna Faber, who has worked with us in many capacities, teaching a lot of courses, coordinating a lot, reading a lot, and becoming quite involved in this education evaluation, both within our department and in the faculty. And is also helping very much with the departmental reviews this year. So I don't think you're bored. Look forward very much to what you have to say on the topic of education evaluation. Thanks very much.
So I'm going to talk about obviously what's been up there, educational evaluation in different settings. So I do it here at the UBC, I do it in the hospital setting or a medical setting, because that's outside of hospitals as well, and in the schools. And so that's, today I want to talk about three of my major projects. The first is a BEd program evaluation. I'm not going to spend a ton of time on that because I think most of you know about that and have seen enough about that with just maybe one quick slide. I'm also involved in the new teacher mentoring program and our project, and so I'll talk a little bit more about that, and then spend most of my time talking about the work that I'm doing with the BC Renal Agency to evaluate and revamp their program to standardize it throughout BC. So that's the plan for today. So my quick zip through the BEd program evaluation. It was initiated by the TEO and supported by the Dean's office when we had the revised BEd program. They wanted to look at, is it working, how's it working, how do we fix it, that kind of thing. So we designed a participant-oriented evaluation that includes all the stakeholders who are mainly involved in the program. That's the students, of course, and instructors, TEO, NITEP, and many people as we could get in there. And we started in August 2012 with an exit survey with the students from the old program, so that we have a comparison, at least at that point, to say when they leave, how are they feeling about things. And we have almost full years. At the end of this year, we'll have 2 full years of data for the first 2 years of the revised program. And it's continuing next year. And we're also, I'm going to expand it so that we're going to look at people who have left. So we're going to go try to get the graduates. It looks like 3 years after they leave, but right now we're just trying to negotiate between what the university is gathering and the industry is gathering. So they only get 1 survey per year, and so hopefully we'll get better results there. So that's my quick overview of the BEd program evaluation. I'm also involved in the new teacher mentorship project, and this is a project funded by the Ministry of Education, so we can be involved with that. It is a partnership between UBC, the BT Teachers Federation, and the BC School Superintendents Association as well, so there's quite a few people sitting at the table for that. And the aim here is to provide coherent, research-based, sustainable, that's for the ministry, we want it sustainable and cheap. How do we help teachers in their early years? And so we, in the first year, included 3 districts there was actually 20 districts that applied to be part of this mentoring project. It comes with support monetarily, but also support in terms of research and going out to the communities and that kind of thing to help them with their work. And so we had Haida, Kootenai, Columbia, and Kamloops, Thompson. And that's a 3-year commitment to these districts so that they get release time for teachers, they get seminars on good mentoring and those kinds of things, and they get to be evaluated on how things are going. For me, that's my part of that. The second year, we took on 3 more districts. This is Sault, Sea to Sky, and Peace River North. These were a 1-year commitment to districts that already had a mentoring program in place, but needed support and some more release days, because of course, many of you who knows, who works with teachers, the hardest part is getting time to do this. And this is our second year. We had a mentorship conference that brought people from around BC. There maybe, we're not sure, but I think we're deciding tomorrow if the Summer Institute will go ahead given the job action, so not really sure, but there's a planned Summer Institute for mentorship. And we now have confirmation that we have funding secured for the next 2 years. So the ministry has supported 824,000, I think, to support this project for 2 years. So we are taking on 4 more districts, and I'm not sure if that's public yet, so I'm not going to announce those districts. There are 2 of them one's very remote, so we're going to use more of technology because there is nobody to go up there and help face-to-face mentoring. So how do we reach those communities that are really remote? And one community has, I think it was 76% new teachers within the first 3 years. So where are the mentors there? So they also will need a different kind of approach. And one thing about this mentoring program that I think is really exciting is that districts can design it themselves. So there is one, for example, in Haida Gwaii, they said we don't want to be mentors, mentees. That's too hierarchical. We want to be something else. So they call themselves peer collaborators. And that's what they are, and they don't do it in the same way, but they're still getting the same support and it works for them. So there may be groups of 3, they may have more fluid groups, so they're grouping on interests. So one group is interested in gardening, and so they are having some high school teachers working with elementary teachers on the topic of gardening, and then maybe have some visits and things like that together, which may not be what's happening in other districts that are more strictly mentor-mentee. So it's kind of interesting. So that's what's happening, and we're planning to develop more clearly a mentorship network. And so that's face-to-face. So some of the districts that were chosen this year are close to some of the more, not really low, but some of sort of trying to build a mentorship center so that this district that's been doing mentorship now for 2 years can then help this district that's just starting mentorship, because they're quite close together. And then when there are meetings or doing conferences, there's some lack of distance. There's less distance to travel than having to always come down to Vancouver. So it's a planned program for building that, as well as an online kind of mentorship hub that's the umbrella of where to go if you want support for mentorship, what is the research behind mentorship, those kinds of things as well. And this has led to a full-fledged research project. So the other one is more practical in what's happening now, but there's a research project called Pedagogical Assemblance, Building and Sustaining Teacher Capacity through Mentoring Programs in BC. We applied for a short partnership development grant, and again, I'm not sure if we're allowed to announce this yet, but we got it. So yay. So yeah, we have $200,000 for the next couple years, so that's really exciting. And these have the same partners involved, UBC, the BCTF, and the Superintendents Association, that are all at the table trying to figure out, using what we already have, some of the data that we're gathering now, and building on that. So some of the overarching goals are, what are the effects of teacher mentorship on teacher effectiveness, leader capacity, and mobilization of teacher knowledge? So one thing that the evaluation is showing is that it's not just the mentees that are benefiting from mentorship. The mentors are saying, you know what, I had to think about why I did this. Or I would say something to somebody and it would make me reflect on my own practice. So I'm being much more reflective. Or the students would come to me and say, blah, 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 inquiry. And I'd think, what do they mean by inquiry? So we'd have a discussion about inquiry, and it would make me, again, reflect on my own practice. It also, a lot of people were saying, it actually changed some of the atmosphere in the school, because there were maybe 2 mentors and mentees working in the school. So now teaching is not just in my own classroom, but it's a collaborative thing. And this person is asking a question, and that's okay to ask a question. So seasoned teachers are coming and discussing this. So we want to see if what we're seeing is not just one here and there, but is it more broadly, and can we measure that? Building this province-wide mentoring program, because the research is showing that, we know that the first few years are the most difficult. And that if we have mentoring, they tend to stay. And for rural areas, they tend to stay longer there, and that's one of the issues there. One of the reasons why they have such young teachers often in more remote places. And also influencing policy, where does the money go, that kind of thing. So I think I said this, but the main goal is, how does mentoring help teachers to be more effective so we can design good mentoring programs? How do we support the growth of early career teachers, and also teachers who have to change what they're teaching? So again, because of the situation that we're in the schools, it's often the case that I plan to teach high school social studies, and now I'm teaching shop. I have no idea what I'm doing. So those people also need mentors, or going from teaching grade 6 to grade 1, that kind of thing. So that was helpful, and learn how teacher knowledge is developed, supported, and exchanged and mobilized through these kinds of networks. So that's the plan for this big study that is, we've had one meeting for, so we're working on it. Okay, so the last thing, the last major project, and the one that I'm going to talk about the most, is this BC renal education program. So that's people who have kidney failure. And one of the main reasons that I got involved in this, well, I was involved in it during my PhD, but I got drawn back in by the head of the renal agency, who was talking about, it's really frustrating that in BC there are many different programs. And so if you are at VGH or at St. Paul's, you may get a completely different educational program. And those educational programs have huge results on what happens to patients. And so, for example, if we can get patients early and get them to make decisions early, big life decisions, then they don't end up on emergency dialysis. So if your GFR, your filtration rate, at 20, you should be making a decision what kind of dialysis I need. If you're going to do dialysis, or if I'm going to do transplant, am I available? Is it possible for me to get a transplant? Because some of the care that you need, for example, if you're doing dialysis, you need a fistula. And that requires an operation to put together an artery and a vein so that you can continually needle those veins. And that takes maybe at minimum 3 months for it to be ready, sometimes 6 months to a year. So if I don't make a decision early enough, then I'm going to end up in the hospital with a catheter in my neck, an emergency situation. Not really it's not good. It's not good for the healthcare system, not good for the patient. So I need to make a decision. Or if you do another kind of dialysis, you have to have a tube in your stomach, same kind of thing. Not quite as long healing time, but really important. So a lot of people are making a decision by making no decision and ending up in hospital, being sicker than they need to be. So that's really important. The other piece was that they looked at how many people who did go to training said they want to do home dialysis. So there's possible to do it at home. And we know from the research that if you do it at home, you are healthier, you are happier, more satisfied with life, you live longer, and the benefit is it's cheaper for the system as well. Even though it's all free, it doesn't cost you as a person who's on dialysis to do anything, it's still cheaper for the system. So it's a win-win all around. And when we train, I don't know, I can't remember what the percentages say, that they will do it, and when it actually happens, most don't. And so if we know people are healthier and happier doing it at home, what can we do to help them make the choices that will? It's not for everybody, some people can't do it at home, but if they can, then maybe they should, or we should train them so they're making wise decisions. So just quickly, the problem that we're looking at is chronic kidney disease impacts not only people physically, but also cognitively, psychosocially, and emotionally. So if you have kidney disease, kidneys are not filtering out your blood goes to your brain, you can't learn as well. Short-term memory is a problem, and attention is a problem. So we're trying to teach you something that's really important to keep life, keep you alive and keep you healthier at a time when you can't really learn. So we're trying to get you early enough to get there. There's anxiety, depression, all these things that are also associated with this. And improve outcomes for these people needs self-management and informed decision-making, as I said. So you need decision-making skills and understanding for things like everyday living, like food and fluids, how much fluids you're getting, what kinds of food you're eating, what's in every food. For many women, this isn't a big deal. We know that. For many men, it is a big deal. I don't know that banana has potassium or those kinds of things. That's what we're finding, but it's still very difficult. So you have to understand that. And as I said earlier, for longer-term care, making choices about what kind of modality you're going to do. Are you going to do dialysis? There are 2 kinds of dialysis, and within those kinds of dialysis, so it's a tree or transplantation. And it's pretty amazing about how the different sites within BC are doing completely different educational programs, what they think is important. All with very good intentions, of course. So the initiative goal was to evaluate what's happening in the province as it is, And then to provide training for the renal educators, because many of them don't have any educational training at all. They are trained in renals, so they know how kidneys work and all that, but they don't know how to get that across to patients. And to develop an evidence-based standardized curriculum for CKD patients. So I'm going to talk about each of those. So the evaluation of the current program, I used a number of methods to get at. The first was self-disclosure. I just put out an email to all the sites in BC and said, what are you doing? Send me your slides, send me your handouts, tell me what your program is, so I could see the variation and put it on a nice little spreadsheet and see where it's happening and what's going on. I also did some focus groups and surveys with the educational practitioners, so there was a 2-day workshop. And during that workshop, we talked about what are you doing, what's going well, what are your questions, what are some of the problems, those kinds of things. I went and observed and found that really fascinating to see what is happening actually in the field. Some good, obviously, and some not so good. This is my And, you know, again, all well-intentioned, but some fixes are really easy. Some, for example, one presenter had the slides up here, and she was at the back of the room, so she was teaching to the back of their heads. So it's an easy fix to say, no, actually, you want to stand up here so they're looking at you, right? And that will really help. Another one-on-one session of about less than 30 minutes, there was a count of 126 questions by the educator. So if you're asking 126 questions in 30 minutes, how much education is actually happening? That's a one-way dialogue, right? What are you eating, what are you doing, with that kind of thing. And I also did observations with kind of surveys that were checklists were written, so I'm just going to quickly talk about that. So I was looking for a match between what people thought they taught and what people learned. So I had, I piloted 2 forms, a checklist and a written form. And so I had the practitioners, when they were finished teaching, I said, write down the things that you taught, and I want you to circle the things that you think people learned. And I went with that, and in the meantime, I had the patients write down all the things that they learned. Then I took that sheet in and I said, and I looked at their sheet and we had a little talk. And if there was something on the sheet that the practitioner taught that they didn't put on there, I'd ask them about it. Because it could be they just forgot that they learned it, but they actually did. And to see what the match was. And also to talk after to the practitioners, what are the important pieces? So yeah, we have some matches, I remembered this, but is this important? And that came out of one session. I spent almost a full day following one patient around there was like 15-minute sessions with a doctor, a nurse, a dietitian, social worker, and pharmacist. And that was a pre-dialysis session, so they are supposed to learn there how to take care of themselves so they can prolong dialysis. And at the end of that day, I was exhausted. I don't know about him, but I was watching it, I was exhausted. And at the end of that session, I said to him, so tell me, what are the things that you learned today to help take care of yourself? And his response was, he had 3 things that he could say. 2 of them were questions that he had asked. So can I drink coffee? And what about junk food? And the third was, come to my appointment in 6 months. After a full day. And I would say, yeah, they did talk about those. But the important things, the things that I would assume are important, because I learned a lot too at that point, I didn't know much about the things that there was. One was guard your veins. You're gonna, if you choose hemodialysis, then you're gonna have needles put in your veins. So when you go for blood tests and when you you pick an arm, and that's the arm they always have to take it out, and you save this arm for dialysis, whatever arm it is. That's, for me, key. Right? One of the key points that should have been there that wasn't there. So anyway, I did this pre-test results, and there was about 48% agreement for the one, so not really good, considering these are things that really need to be done. But if you had a group session, it was even worse. It was 34. So really, yes, really bad. And it also, there was other variables varied by components, practitioner type, location, all that stuff. But basically, we can do much better. So in terms of providing training and support for the trainers, that's a big part of what I'm doing as well. And so we've had a number of opportunities for formal and informal training. The first was a 2-day workshop. There's a title, it's not that important. So we had two full days of how to educate adults. What are they doing already, and how do we use that to make sure that they're not doing all the talking, that they're actually asking not too many questions, but some questions, those kinds of things. What kind of questions do you ask? And that was very well received. We had a renal educators training session, so these are the ones who have educational training, but helping them do better to help educate others. I've presented the findings thus far, so they were, for example, with that one patient that I followed that day, I met with all of them after and said, what do you think he learned, and then told them, and they were pretty darn shocked because he was young, quite on the ball, so that kind of thing. So talking about that more informally and more formally in terms of presenting them like this. And I was a speaker at the BC Kidney Days talking about educational practices. So trying to do this as much as possible, getting as many people as possible. And curriculum development. The choice was to start with modality choice education. So there's many pieces to the renal program, obviously. But one big piece is, okay, I know now my kidneys are failing. I have to choose something. So which modality am I going to choose? So these are the choices. And actually, this is a piece of the program from a Prezi that we've chosen to use. And so they, again, as I said, even if you choose peritoneal dialysis, PD, there are different kinds of PD, manual or machine, that kind of thing. Hemodialysis, many kinds of chemo, transplant, or conservative care. And conservative care is a euphemism for not, I've chosen, hopefully, with all the information needed, that I don't want to do anything, and that means that I will then die. Okay, they'll still be taken care of in terms of managing pain and all that, but it's making a choice, and that's a legitimate choice as well for some people. So there was a pre and will be a post evaluation, and that includes patient interviews. So I have two wonderful research assistants who have been calling patients throughout the province, looking at different, I don't want to say different kinds of patients, but different, kinds of patients, ones who are just after the training, people who are already on dialysis, people who have done transplant, people who have chosen conservative care at different stages, so we're getting many different points of view. Done surveys with the practitioners who are teaching and with some patients, and we have quantitative outcome data that they collect at the renal agency, so how many people are going on emergency, those kinds of things. And the curriculum then needed to be designed, and I'm not a expert in kidney disease, so that was in concert, obviously, with all the people who are out in the field. Many, many changes to the curriculum, many more people wanting to add in more, and I keep saying it's need to know, not nice to know. If it's nice to know, we're not putting it in there because it's already long, that kind of thing. So looking at content and deciding on the platform, which you saw was Prezi. And I designed an instructor's guide and did training for the pilot group, which is happening right now. We're in pilot phase, so there are 4 sites in BC that are piloting this. I'm going to all 4, but I've been to 1 thus far. It's been a crazy summer. I had 6 sites to visit for the new teacher mentorship program this month, and 4 for this, and very interesting to see it in action. Lots of changes to be made, obviously, but some really great things, and the patients were talking and engaging, and I saw before my eyes one patient change his mind from I'm not doing dialysis, what I did, that's it, not doing it, to I'm doing PD. So that was really great, so making better choices, I think. And that's my quick spiel.